Should we wait for Kim to come back?
We'll see if she pops back in. So we're ready to go. I wanted to thank everybody for taking the time out of their day to spend with us again for our practitioner panel, today being on pain. Thank you all of our volunteer practitioners who are here to discuss that topic. Integrative Healers Action Network is a group that provides disaster relief at Red Cross shelters traditionally. Our mission is to transform trauma into resilience for communities that are impacted by disaster. We as an organization have pivoted quite nicely, in my opinion, and are now responding to COVID as a disaster with these virtual offerings. So I hope everybody enjoys these panels. We also have a free homeopathic medical clinic that happens on Thursdays from 2 to 4 Pacific time. You can find that information on the Integrative Healers Action Network Facebook page. My name is Cynthia Mears. I'm the Director of Volunteer Services for IHAN, and I am always looking for volunteer practitioners. I'm always looking for administrative volunteers, whether that be on the ground when we do a response, or if it's virtual and you can offer some administrative assistance. Please feel free to comment on our page and I will reach out to you. So without further ado, I will go ahead and hand it over to our panel that's going to be discussing pain today. This will be an organic conversation and I'm really looking forward to hearing what everybody has to say.
And there's Kim.
And to go to my house.
That was very nice.
Perfect.
You did, yes. So we're ready to go. We're just going to start the panel. So whoever wants to start first, if you want to just share, your experience around pain, if you have particular case studies that you want to share where you had really great results in each of your modalities, explain to the viewers who you are, what you do, and then if we could give our viewers some insights into things that they can do, whether that be with a professional or at home, that would be really helpful.
Well, thanks, Cynthia. Anyone want to jump in first?
Go ahead.
So many people actually know about homeopathy because of arnica, which is a sort of a common remedy that you find over the counter. People will take it after injury or after, so like I have a holistic dentist who will recommend it after dental work. And it can be, it's a great thing to have on hand, like in your sort of disaster kit, because any kind of, a fire, of course, or even an earthquake here in California, anything like that, it can help just to sort of, with that kind of shock response, like to kind of help smooth that out, I guess you could say. It's great to have if you have kids and they fall down and, have like a swelling scrape, like the arnica can help speed up the healing, help with the pain. I've heard of people taking it with back pain. They would like take some arnica before bed, and over time the back pain got better. So arnica is just a great thing to have on hand. Like it's available, as I said, over the counter. So any kind of natural food store, you can find it. So sometimes it can be topical, like kind of in a tube. And then if you're probably familiar with these like blue vials, these are homeopathic remedies, and often a health food store or Whole Foods will have like a little stock of them, and arnica is one that they'll definitely have in stock. So it's a great thing to just like, if you've never tried homeopathy, to just try it out.
I'm Dr. Chris Holder. I work at Live Oak Medicine. I like to think about pain as that there's kind of two types. There's acute pain, like if I took a hammer and smashed my finger right now. There's the pain of it sending a signal to my brain saying, hey, you just smashed your thumb. And then there's long-term chronic pain. And the two are a little bit different in how they're gated through the brain. So the brain will process that signal. And depending on the story that we tell about the pain, that might keep us in pain. I happen to work with a lot of people that have experienced pretty extreme trauma in some cases, and sometimes it's linked to pain that they're having. The example I always use when I'm teaching people about this is, let's say I've got a hot plate sitting here on my desk and I accidentally put my hand on it. My spinal reflexes will have me rip away my hand faster than I can even think, wow, I put my hand on a hot plate, because we have these automated responses to pain. But in a second scenario, if I take this person's hand and I place it on the hot plate, same amount of time, same amount of energy, and let go, most people know that that second scenario will cause more pain. The why of that has to do with it is actually going to get routed through a different part of the brain called the amygdala that will then encode that experience, because somebody's doing this to me on purpose. And so I'm going to experience that as much more of a traumatic event. My brain's going to remember it. I might, anytime I consciously or unconsciously see something like a hot plate, it might trigger me to have an experience of pain, or at least anxiety and fear. So I usually, when I talk with patients about their pain, I try to figure out, what am I dealing with here? First, is this some old traumatic response, or do they acutely have some damage to something?
Yeah, hi. Excuse me. I'm Ladina Jean. I'm a doctor at True Health Medicine. And I agree that's a really important distinction, because the experience is very different and the relationship to the pain is quite different, and also dictates that the treatment is different. And so sometimes we're dealing more with long-term suppression of inflammation. Sometimes we really need to look at and include a piece of mental emotional health and consider the relationship that someone has with their pain, just like Dr. Holder was mentioning. And so occasionally with that trauma and that experience, there's this missing piece where we can throw supplements, we can do narcotic-based pain medications, and we still see someone suffering and not recovering from their pain. And there's often that missing piece where someone needs to really receive some type of therapy or touch, massage. Sometimes is incredible. Acupuncture can be incredible. Sometimes using tools like acupressure at home, or emotional release techniques that patients can learn to work with at home to disengage that relationship to the pain when it gets turned on, because the signal just keeps looping in the brain. So it's a very, very important distinction. And I think when I was participating in this forum a couple of weeks ago, we talked about EMDR as a potential type of therapy for folks who are suffering from tremendous pain or trauma associated with pain, as an incredibly successful technique. And I just wanted to mention that again in response to what Dr. Holder had mentioned, because I have often found that in my practice to be a missing piece with someone.
I'll jump from there. I'm glad you guys brought up that missing piece, because this is something that I work with a lot with my patients, and I think of it as reframing pain. So reframing our experience of pain. Pain is an inevitable part of life, like whether it's physical or emotional or mental or just dealing with life. That's something that always comes up, but we have choices actually as how we react to it and how we process it and move through it. And when we start to resist it a lot and push it away is when we increase the amount that we suffer from it. I actually like to do a little practice if you guys are into it. That's like 5 minutes to help give you like an experience of what this is like. So anybody watching, you can just close your eyes and sit in the chair that you're in. And to do this, we want to be really still. So I'll remind you throughout to stop moving. So as you sit with your eyes closed and tuning into your breath and feeling your body in the chair, and just notice a part of your body where you have pain. If you don't have any pain, you can pinch your finger with your nail to cause some pain to experience this. Please stay still. And as you notice that area with pain, try to make it go away. You can try to push it out, you can try to ignore it or pretend like it's not there. You can put all of your anger into it, trying to scare it away. Just pull out all the weapons against pain that you have. And you can come back to center and let the pain focus go and take account of your breath again. And now notice that pain again, but this time have curiosity about it. You can look into it. Maybe it has a shape or a color or a texture. Please stop moving. You can follow it, see where it started from. Maybe it even has a message for you. Just be curious and inquisitive about that pain. And you can let that go and come back to your breath and open your eyes again. So when I do that practice, I notice that when I ignore or try to make the pain go away, it becomes louder. And when I get curious about it, it sort of lets go a little bit. It might not go away entirely or at all, but the fighting of it stops. And that's where we can really help people with acupuncture, and with the EMDR is where we're kind of just like unlocking the attachments around the pain. And that improves the quality of life. Like with a lot of the modern acupuncture studies on pain, they find, like sham acupuncture, regular acupuncture, conventional medicines kind of have similar effective rates as far as pain reductions. But with the regular acupuncture, individualized acupuncture, there's usually a significantly different quality of life increase there. And that's around this sort of having that different experience of the pain, not just trying to mask it with medication, which is sometimes really necessary so that we can do the work to really move through it. But we have to do all those pieces at once.
Thank you. That was lovely. Thank you. And such a great understanding and demonstration of how we relate to our pain. And I think it's always a focus to make the pain go away or numb it. And sometimes in an acute situation, it's not always possible, right? And so that is it's definitely a very useful tool. I want to talk a little bit and then hop in anytime, anyone, I just wanted to keep the conversation flowing and talk a little bit about mental, emotional, just during this specific time with the pandemic, and how, exacerbations of depression or anxiety or being isolated from our loved ones can also exacerbate chronic pain. And our relationship to that pain. So I just wanted to acknowledge that this is really a time where we might see that folks are suffering from pain more than they might be in their regular life before we were isolated. So I think it's important for all of us to maybe consider, contributing some at-home tools to, like the arnica, which is an amazing idea. And I just wanted to talk a little bit about usefulness of like just simple things like hydrotherapy, which just means, alternating hot and cold compresses. And so the concept is something we sort of all understand from sports. When we were younger, you sprain your ankle and you shove your swollen ankle in an ice bucket and try to hold it there as long as you can, which is kind of miserable. And then what that does is it helps reduce the inflammation in that acute situation. We sort of think about that a little differently when pain becomes chronic, and sometimes even in the acute situation. So knee pain, back pain, elbow injury, whatever it is, we think more about alternating hot and cold, and that's for a lot of great reasons. So the hot really dilates the blood vessels, opens them up, and allows new blood to flow into the area and bring with it nutrients. And on the same, it allows the trash to be taken out. And so a lot of the inflammatory markers and a lot of, the stuff that's causing some of the discomfort in the area is being carried out. And then we put the cold compress on, we get this sort of pumping action with those blood vessels where they dilate and then they contract. And so there's a lot of benefit to just doing something simple like that at home. And it's quite easy. You could take a really, really hot bath and then stand up and run yourself under freezing cold water for just a couple of seconds, and you can alternate that in sort of more of a full body. You can use hot, cold towels that you've soaked in cold water with ice, and then a bucket with warm water. These can be really effective. You can add magnesium, like Epsom salt, to the water. And there's plenty of other things you can do at home as well. It's just some thoughts that I had if other people have things to add.
Yeah, I think that's a good point you brought up, that this sort of the emotional stress that's going on right now could exacerbate people's chronic pain. And it made me think about, of course, caretaking of the pain of these various ways that, arnica, the hot and cold, the meditation that Kim offered, but also to take steps to address the emotional stress, like connecting with people, over Zoom or the phone, or, a hot bath can certainly be a stress relief, as well as actually managing physical pain, but to do those things as well to lessen the emotional impact as much as we can during this time. And then maybe that if the chronic pain is getting exacerbated, maybe doing those stress relief items can turn the volume back down a bit on that.
Yeah, I think, in terms of other resources for home, something I think about too as not just stress relief, but a way to work through pain, but also a way to keep us moving, because, movement is really important in terms of preventing chronic pain or injury, and also managing it. Is, for back pain, we understand that we really want to keep our core strong, because it is a balancer that really helps to limit some of that back pain. And something that's easy is we all have access to a million apps on our phone now, and there's, you know, tons of free yoga apps. There's one that I use at home called the Yoga Studio. They have different versions based on your fitness level. And sometimes when you're dealing with something like chronic pain, we don't want to even think about it as exercise. We want to really think about it as movement. And yin yoga or restorative yoga is a really great resource, because it's sort of intended for folks who are working through something, so that they can still move. And there's that really amazing benefit of stress relief that's sort of included in that, with breath work and attention to your body. That sort of plays into what Dr. Kim was talking about, which is the relationship with your pain as well.
And then, you know, self-massage and acupressure are also great tools. I have a video on my website about that that's sort of more geared towards stress, but we can do acupressure and self-massage. I particularly like those little hook-shaped things. But, you know, like the tip of a pen is a really great way to get at some trigger points if we have them. So looking up, you know, oh, that feels so good. We can, you know, if you're having back pain, there's a lot of resources too online. And, you know, like the acupressure maps are really vast, and that's totally overwhelming. So I think looking for trigger points is going to be most effective for people at home. And there's, you know, apps for that are free too. And they actually map the body, so you can see, you know, you could tap on the little body that says, you know, I hurt in my leg right here, and it'll show you the trigger points, and you kind of feel around and see which ones are sensitive. And I think, and just press and hold on those, usually with a tool like a pen or that twisty self-massager thing, are going to be the best ways to go, because to really do an effective acupressure protocol on yourself or on another person, we actually need to really do it hard, where it's probably, you know, not going to feel so great. That's why like acupuncture is nice, because we're a little more direct. But when we're doing an acupressure treatment, we want to be really firm and really strong in those points and hold them for a while. So like 1 to 3 minutes, not just like a little bit at a time. And that goes along the lines of stretching too. When we're doing static stretching, it needs to be like a minute in a certain stretch to really get the full therapeutic effect of it. Yeah.
And Kim, do you see good benefit for patients combining things like the arnica cream with the acupressure?
For sure. And everybody's going to be really different. I like a lot of the Chinese liniments, and in the Chinese herbs and liniments and the things you can buy out in, you know, Walgreens or whatever, where you have like Tiger Balm, Icy Hot, Salon Paws, or whatever they're called, they kind of range in temperatures. So some things are going to be really warming, and some things are going to be more cooling, and you kind of need to experiment and find out what's right for you if nobody's giving you a direct recommendation for what you're going to use things for. Also, there's a lot of the CBD creams and things that people are really into, which also have a lot of those herbs in them. So you can experiment. It's just all about, everybody's going to be really different, I think, and the different types of pain too.
In the same way that I try to separate out like acute from chronic pain, I sometimes will think about, you know, is this pain coming from inflammation, or is it because the garbage that the cells are making isn't being taken out? And so if it's a garbage issue, that's where increasing circulation through hydrotherapy, lymphatic brushing, massage, acupressure, these all might be helpful modalities for that, because they mechanically will help move the stuff that the cells are kicking out, especially if your pain is more like mine, where it's like achy muscles and want to wiggle and move all the time. That's very helpful for that. versus the other type of pain. Did that make sense? Yeah.
Mhm.
Okay.
Yeah, it's thinking about movement and wanting to kind of move. And sometimes having pain restricts that. It reminded me of a client I had recently who was suffering with shingles, which is brought on by stress. So people may find themselves in that situation. And she really wasn't able to move her shoulder due to the shingles. And the remedy I gave her is decreasing her symptoms and her pain, but she's still, when she moves, even if she's not moving her shoulder, she's moving the rest of her body, she gets that pain activated in her shoulder. So even just finding kind of what's the minimum amount of movement you can do without exacerbating the pain while it's healing.
Exactly. And you make a great point. There's a huge distinction between musculoskeletal pain that's coming from a specific site or location versus a nerve type pain. And I would think too that the treatments that the ways that I address that are quite different. I would say hydrotherapy is still really effective, as is all of the other mechanical things we talked about, like massage and acupressure. But if you have a knot in a trigger point and you put pressure on it, it's going to release and it's going to give you some relief from the pain, as a massage might as well. Whereas if you have nerve type pain that's really severe, you might not get that same kind of relief. And in fact, sometimes massage can be kind of intolerable in those spots where the nerve type pain is really severe. So the treatments for those sometimes that we like to focus on are things that really nourish the nerves. And we know over the counter some really safe things to consider, things like B vitamins, higher doses of B12. Those are safe. And then sometimes we talk about things like glutamine because they nourish the nerves. And there's something called an alpha lipoic acid, which provides some nourishment as well. And you know, with nerve pain, it can be coming from a more severe source. And so if you're not sure and you have this type of pain that you can't quite identify the source, we call it radiating. So you sort of think it's here, but you feel it down here and you're not sure. I would always encourage you to really talk about that with a provider, because that could be coming from other serious causes. Sometimes a herniated disc, we feel that down our leg. But diabetes, undiagnosed and even diagnosed, we can get nerve pain from the damage from diabetes. And so that's something just to consider in that chronic disease realm, can be a source of pain as well, rather than an injury to the tissue specifically.
I had an interesting case I wanted to talk about where a few years back when I was practicing acupuncture up in Seattle, I had a patient sent to me she had put her face through the windshield about 3 years prior and was having a lot of pain. She did have multiple surgeries. We took some imaging and looked at things, and things were lined up pretty well. She didn't have damage to the nerves. And so I put her on anti-inflammatories and did a bunch of acupuncture. But week after week, she never really got better. And when I asked her about it, she said, well, I'm not really in pain all the time. It comes and goes. In fact, I'm not really in pain at home. It's when I'm out and about. And I said, okay, that's strange. And I said, so you can go from like no pain to 10 out of 10 pain very quickly. And she said, yes. And I said, well, that's bizarre. I said, go home and just see if there's a pattern to it, you know? And so when she came back, she said, it's only when I'm driving. I only get this pain when I'm driving. And I was like, okay. Doesn't quite make any sense in Western medicine why you'd get searing face pain while you're driving. I then said, okay, keep looking at that pattern. and see if anything arises. And she came back to me and said, Red Ford Explorer. And I said, Red Ford Explorer what? She said, it was a Red Ford Explorer that rear-ended me 3 years ago when I hadn't had enough time to put on my seatbelt. And I said, oh, I bet unconsciously your body is responding with pain whenever it sees this, because it interprets it as this. And so I stopped doing acupuncture, and we did a deprivation, or a de-escalation therapy, where we went and found a Red Ford Explorer in a mall parking lot and had her talk to herself, basically saying, this is not the Red Ford Explorer that hit me. That was on this date and time. Today is this date and time. 2 weeks later, she had zero pain. And she had been on narcotics and the whole 9 yards. So sometimes pain can be gated through the brain in very strange ways, especially if what's happening is not making sense. With that. Think about those sorts of things.
Yeah, that's a great example of what we were talking about earlier, huh?
Yep.
Thanks for sharing that story.
So
Anyone?
I'm curious, I'm sorry, Medina.
No.
You know, we're talking a lot about the underlying issues that can exacerbate pain, et cetera. And even though it's not exactly in, you know, a direct pain context, can you talk about homeopathy and what you can do about some of those underlying issues, like, you know, trauma, overwhelm, you know, a lot of the emotional components that you might be able to treat using your modality?
Yeah, sure. I can start with homeopathy. That's a great story about the car accident. It makes me think about kind of the homeopathic intake, which I think Mary Johnston spoke about as well. So if you do get to that point where you decide to go into a homeopath, you know, for chronic pain or sciatica, or you get shingles, or, you know, whatever it is, the intake is usually like 1 to 2 hours. And so the homeopath will find out about whatever it is that's bringing you in, but we'll try and also get the fuller picture, kind of, you know, what was going on when it started. You know, a car accident, it's quite obvious and memorable, but there might be something else that was going on that the person didn't kind of put the pieces together. And so that's kind of part of how homeopathy works, is trying to create this full picture to try and see, like, okay, what to address first, what remedy to give. I talked about arnica, but, you know, if someone's finding that arnica's not working for them, there's various other remedies, particularly with nerve pain. There's a remedy called hypericum that can often be really helpful for nerve pain, which is also a common over-the-counter remedy. And as Cynthia mentioned, there's going to be the homeopathic clinics online, sponsored by IHAN. So if any of this has you curious, come check that out on Thursday afternoons.
Great, thank you, Delilah. Ladina, I just wanted to let you know that, is it Dr. Christine, how do you pronounce her last name?
Yubi?
Yubi, she says hello. So
Well, thank you.
I don't have any questions from anyone that's watching on the Facebook Live, but are there any other things that you want to share with relation to the pandemic? Maybe it's not directly associated with pain, but some tools that we can offer for the people who are struggling, maybe in any of the areas right now?
I was actually thinking that headaches might be a good thing to go over.
Great. Yeah.
Because I imagine people are having lots of headaches right now with all of the screen time. It's kind of a lot. And there's, you know, as we've been talking a lot about different causes of pain, and headaches come from all kinds of different things too, which can be from dehydration to being tired, too much screen time. I had a migraine the other week from that and had to buy some of those blue light blocking glasses, and I will say they actually work. I was very skeptical, but those were really helpful. and just like taking breaks, which we're not really doing, or sitting on my couch working instead of at a desk. All of these things are really exacerbating all of those headaches, or like the neck pain that's causing the headache, and getting at all of that. So my personal recommendations for headaches is, moving and stretching, and not like setting an alarm on your phone every 45 minutes to get up, like more than once an hour is really important. And then keeping with being hydrated. I like to do this like sticking my head forward thing, and so remembering to come back like that is also really helpful. And what else have you guys got?
Yeah, I think it's important, and probably ties into what I think the topic was last week for y'all, which was sleep, right? And so poor sleep, certainly for folks prone to headaches, is going to really exacerbate that during a time like this. So if you are waking up in the morning with headaches, it might be better to focus on how to get good quality sleep, and to review that live forum from last week and get some good ideas about how to promote healthy sleep and sleep hygiene. I think there's some handouts available on that, because that can make a world of difference. And then, I want to talk a little bit about diet too, because I think it plays a big part here during the pandemic, because I think we're all potentially eating a little bit differently than we're used to, or a little bit more than we're used to. I think for me, it's been a positive change because I can focus on really healthy foods and cooking all of my meals, and we're not eating out. But the first week I noticed lots of snacking that I had to rein in. And so I think it's important to just maybe make sure and tidy up your diet a little bit, and make sure you're not eating a lot of those junk foods like fried potato chips and lots of sugar and lots of caffeine, because all of those things can really contribute to headaches too. It can also contribute to poor sleep. So that might be a little bit of a connection as well.
And the alcohol.
Yeah, good call.
This is I feel like alcohol in moderate doses is actually a very helpful tool if people can use it with awareness like that, but we're kind of trained to not do that at all. So there's a lot going on there with just the body processing it, the mental processes that go through after the fact, the dehydration that's coming into play, the way that it affects our sleep. Just being really mindful of how we use alcohol during this time. Mm-hmm. Trying to stay present and aware while drinking, and being moderate about it instead of just mindless about it, or getting into a habit is a really tricky slope.
Can someone talk a little bit more about what an inflammatory diet looks like versus anti-inflammatory, and how that works with the body? Because I know, my own experience in watching media, there's not a real correlation between diet and pain or how you feel. You can eat whatever you want, and actually some food that you're not supposed to have makes you happy, and so you should eat more of that. So does anybody want to take that on and just address what's actually happening in your body when you eat those foods that you mentioned, Ladina?
Yeah, Dr. Holder, do you want to speak to that to get started, and I can kind of fill in?
Sure. I like the way they talk about it in Chinese medicine, where there's kind of two things that we digest. We say digestion, and we think of food and assimilation of that. And then there's also the digestion of everything that's coming in from the senses. And so in addition to trying to get my patients to clean up their diet to an anti-inflammatory diet, I've also been recommending in the same way that the news and social media that we're consuming, we might need to take a fast or regulate that as well. Both can affect digestion, both can affect headaches and things like that. In terms of food, I always say eat organic and close to nature. So the more humans have mucked with it, the more problematic it can be for health. And especially during this time where we have a little more time, people are prepping their foods more. We could not find baking yeast to bake bread the other day when we went to go get some, because people are making it, which I think is great. But yeah, again, just to really think about like everything that goes in, there's a certain amount of garbage and it has to go out, and that includes media. And so I've been prescribing media cleanses and media fasts, and also just encouraging, like, part of the addiction of Facebook or Instagram or any of these things is we want to connect with each other. And so I've been talking, call your friend, video them.
Right.
That you really want to connect with and have a real connection.
Yeah. I think it's important to, there is an individual component there to really consider with what is anti-inflammatory for certain people versus others. We get into this realm of talking about food sensitivities and food intolerances, which could be quite different among all of us as individuals. Some of the main ones for folks really tend to be cow's milk, dairy, gluten is a big one. Oh, my puppy is saying hi to everyone in the background. And then, I would say across the board, a lot of outside of your own personal food intolerances and then folks with autoimmune disease have a certain tendency to be aggravated by, in particular, their food sensitivities and just junk foods in general, because that increases the amount of inflammatory cells that we have floating around in the body. And so that can increase our pain levels. It can increase swelling. It can increase gastrointestinal issues. It can even go as far as to making women's menstrual cramps worse each month. So back to, well, what are those inflammatory foods? I think we all sort of know what they are intuitively. It's a lot of fried foods because the actual structure of the oil that the foods have been fried in changes, and that oil is no longer what we would call a healthy oil for the body, and is pro-inflammatory. Too much sugar, dairy can be very inflammatory kind of across the board for a lot of folks. So I would say that's the gist, and alcohol overconsumption as well is a big piece. So stay away from the junk foods, focus on making your own bread and your foods from scratch at home, because it's always the best way to go. That concept of shopping around the perimeter of the grocery store and staying off of the middle aisles, right? As little as you can do, from the frozen foods and from the canned foods, those are the foods we really want to gear away from. You're going to get more nutrition from that big basket full of fresh vegetables. And I know that's, we've all been kind of struggling with staying out of the grocery store on a weekly basis right now. And so we're all doing the best we can, but try to keep those things in mind.
Great, thank you. So we have close to 10 minutes left. Does anybody want to talk about anything that's on your mind? Are you seeing things in your practices that you feel like are really related to this pandemic that you can offer some insights into?
I think kind of along the lines of all this, I'm seeing a lot of, because we're in a situation where we're considering our mortality and that there could be death involved, that it's activating a variety of different survival responses in people. And some people's survival response is to follow the rules to a T. Other people's survival response is, I'm going to take care of myself and not anyone else. Other people's survival response is extreme anxiety, even beyond what people are suggesting. I really have just been trying to work with patients in processing that, and also looking at where it might have come from, like what might have happened in their ancestry to make them respond in one way versus another, and to also understand that those other people that are responding in other ways that seem really bizarre to us, that there might be reasons why they're responding in that way. You know, so the folks in Michigan with the guns protesting, something happened in their family line to make that be very important to them. And then other things have happened to others of us to make that be the most important thing to us. And having a little bit of flexibility and ability to have hard conversations while we reshape society.
Medina, are you seeing anything that I know that your patient population is a little bit different, but are you seeing anything that you feel like is, you're seeing more often than you normally would that you could share?
Yeah, I didn't speak up because we keep talking about it over and over, and I guess that's because it pops up for everyone right now. But certainly in my population, I'm dealing with a lot more sleep issues. I'm getting contacted so frequently with folks who have never dealt with sleep issues, who now suddenly are not sleeping at all, or they're sleeping 2 or 3 hours a night and staying awake for 2 or 3 hours a night. So I'm getting a lot of practice and tools in what works for different situations for sleep. And then I would say anxiety. I'm seeing a lot of anxiety, whether it's anxiety around their own health or their family's health, their children's health, the health of our planet, and our other human counterparts. There's a lot of anxiety that keeps coming up. And so a lot of time spent addressing that in non-pharmaceutical ways, because I feel like it's an acute situation, and hopefully short term, and something that as our world shifts and things sort of start to feel more comfortable, the anxiety levels will start to dissipate. So I work a lot with herbs and nutrients to help folks find that balance of sleep and anxiety during the day. A lot of common over-the-counter things like valerian and California poppy and passion flower, and some nutrients that you'd probably want to discuss with a provider a little more closely because they have some interactions. Yeah, so those are the things I'm seeing every day. Patients with other health concerns, other things that we commonly talk about, they're all contacting me with those two major issues right now. And so just doing a lot of at home, what can you do at home to help yourself? And like Dr. Holder, I'm also prescribing a lot of, okay, you've listened to the news enough. It's time to cut it off. You need a break. Your mind is replaying everything. You can't have NPR on in the background for 12 hours a day. You have to cut it off. You have to stop. You can allow yourself a window of time in the morning, half hour, check the news, get yourself up to date, and then move on. And same thing with the social interactions. I'm fairly introverted, so this has been a great lesson for me in learning about my friends who are incredibly painfully extroverted and thrive on human contact. They're struggling. They're struggling. And so I kind of have like settled into this, and I use the time for my artistic, growth and nourishment. I want human interaction too, but I have several friends that it's been a very painful process for, and we've all worked out ways of trying to support them through FaceTime and phone calls. And there's this cool app called House Party, if anyone's seen that. It's pretty fun. Like 5 or 6 people get on at a time, and you play a game and all laugh for an hour or half hour and hang up and move on and get off the computer. And you've had this sort of more meaningful interaction. I find it so easy for folks to get lost in the trap of staring at Instagram or Facebook. And I'll just reiterate what Dr. Holder said, it's not really a real interaction. And even though there's some sense of feeling connected, you're not really connecting. So I think that's an important piece because we're all deprived. I mean, when is the last time that you had a hug if it wasn't from your partner, right? I saw Dr. Jen a couple of weeks ago, and our first initial reaction was we wanted to hug each other, and we both had to stop and say, okay, yep, hi. You know, so it's a learning curve, and I think it impacts our health in ways that we don't even understand yet.
Yeah, it's definitely a tough situation, and you know, I'm excited that Integrative Healers Action Network is going to be responding to the pandemic with offerings like this ongoing. I think that it's going to be a long healing process for people, and I'm excited that we're going to be able to support that. So I just want to thank you all again for all of our viewers on Facebook. Thank you for tuning in with us. Thank you to all of the volunteer practitioners who participated in the panel today. A reminder again that we do have a free homeopathic clinic from 2 to 4 Pacific time. That'll be via Zoom. You can get the information for that right here on our Facebook page. We would love to see you. It will be a private meeting, so you'll go into a separate virtual room with the practitioner. And I hope everybody has a great day. I look forward to our panel next Thursday. Thanks, guys.
Thank you.